glamorous. It's really hard to bring up the rear of a very long but exciting evening where everybody's really hot and dehydrated. So I'm going to try, I'm not going to go on actually. I did not prepare, and I purposely didn't prepare because I could see that I was coming at the end. And so what I didn't want to do is to repeat what I was sure the 8 people before me were going to say. So essentially, who am I? Yes, I am an obstetrician and gynaecologist. I work at Imperial. I do wear a number of hats. Some of you may have seen me on some TV. Some of you may have heard me on the radio. I'm going to be on BBC Radio 5 tomorrow at 12 o'clock. We're going to be talking about women's health and sport. So do tune in. But essentially, my whole ethos is about delivery of women's care and making sure that all women, wherever they come from and whatever they look like, get access to the best care. So when I, as well as my colleagues, set up the first Race Equality Taskforce for any medical college in 2020, I realised that I came in with a lot of bias. I came in with bias because I work in a brilliant unit, and I assumed that health was delivered as it is where I work across the country, but that's sadly not the case. And so for the last 5 years, we've very much been working on how we can even out this disparity. So in a way, let's talk about what the reality is of women's health currently. So today, I had an antenatal health clinic. That is where women come along when they are pregnant and they come and see myself or members of my team. And I had 24 women to see, and myself and 2 junior staff, and not enough healthcare workers. I then was interrupted by such an amazing colleague of mine who is the head of perinatal mental health. And she is just one person looking after 300 women. And she told me today that she's going to hand in her resignation. So I had to stop the clinic and sit down and work out a plan of attack of how I was going to get the executive team to understand the burden of work that my lovely colleague is doing. And this is incredibly important. So any of you who have read Embrace, this is the maternity audit. The last Embrace report shows the importance of perinatal mental health and the outcomes. So that's one reality. Today, obviously I left a little bit early to come here on time, that I have a patient in labour at the moment, but ordinarily I would have been performing a gynae clinic, and in that gynae clinic, as you have heard, women are waiting for such a long time to see me. But when we talk about disparities, in a way, sometimes we can be very lazy. Everybody talks about, black women and Asian women, but actually disparities reflect or present themselves in so many other ways. So one of the other ways that I witness the disparities is that I also deliver private care. I deliver private care from Harley Street. Sounds very glamorous. It is, but not for me. I have to say I sit in the basement because that's where the ultrasound machine is. But what I see are women that have the money and the means that come to see me and they skip the queue. Okay, and they skip the queue because they can. And if I had, actually I do have private healthcare, I would use it. I took up private healthcare for the first time ever last year because I realised that despite being a consultant at Imperial and having all of my great friends who are consultants, I still would not probably get the care that I need. And so this really does break my heart when I realise that it's not necessarily women who are super rich and I see on High Street Kensington. They are women that maybe have healthcare by way of their workplace, or so many women that actually save up their money and come to see me. So this is where disparities are alive and kicking. But we've spent so long talking about what is so difficult and what is so sad and depressing about women's health, and this is not how I wanted us to end this particular meeting. Lots of people have asked me about my views on politics. I am apolitical, and I think it's quite important, anyway, from my position, to be that way. Because it allows me to have the clear-eyed view to be able to challenge people, irrespective of their colours, when I think that they're veering away from their goal and their ethos. And that goal and ethos should be about us trying to deliver a healthier and fairer society for all. okay? So this means working with integrity. So for all of you here today who have been elected to Parliament, well done. I was very happy with the results. However, it's important that the enthusiasm that we've started with, we continue. Now, we are so excited about, so many women being here and potentially a female American president, but actually being a woman is not enough. You have to be a woman who actually likes women. And that's not necessarily given. I just make this point. Being a woman does not necessarily mean that a woman will work towards the agenda. And also, being a man doesn't mean that you're necessarily against that agenda as well. It's about us working together. So I would like us, in a way, to consider everything that we have heard today. Number one, that yes, maternity services are under a lot of strain. That is the truth. However, the maternity services are doing such an amazing job, and we must remember that we do have one of the lowest maternal mortality outcomes in Europe, actually in the country, compared to America as well. You would be shocked. Where the problem is where we see the disparities when we look through the lens of race or other inequalities, and we must work towards reducing that. We do have a problem with our gynae waiting lists. We do have 660,000 women waiting. This is a problem that I come up against time and time again when I come to perform an operating list and find that my operating list has been cancelled. And often the women's health operating lists are the first to be cancelled in a hospital. This is unacceptable. Partly it's because there are not enough women in the executive board to be able to push back and to have our voices heard. So to challenge that, all of us have voices, women and men. We need to make our voices heard. My third challenge for you guys to take away today is about when we think about policy, that we make sure we have the right people in the room. This often includes women, and women that have the experience. There are so many of us clinicians who witness and experience and understands the problem daily, but often we are not in the room where it matters. Any of you who have seen Hamilton will know where this comes from. Okay, but really, we need to be in the room where it matters. Yes, over time, I do a lot of work in policy and engage with government. And what's interesting is that sometimes the right people are not often in the right spaces. This is important because we have to know the right questions to ask. There's no point looking for answers if we haven't asked the right questions. And so often we've started off from the wrong question and then we're getting the wrong outcomes. So then this leads me into data. Data sounds sexy. Everybody's talking about data in tech, but often people have not thought about what are we trying to use the data for? What are we trying to understand? Again, this is about the right people in the room. I just want to challenge my lovely friend Janet about manifestos and women's health. I and a team at Imperial, we did a very boring job of reading every single manifesto for every single party, and we did a score. And actually we found that for a lot of parties, women's health featured only briefly, actually. And it's not just women's health, it's looking at the whole gamut of women. Often women only come into a discussion when we're talking about our health. I am not just a walking uterus, okay, and women are not just important when they're pregnant or going through the menopause. It's also about the societies in which we live, our environment, our pollution. I have one of my lovely friends who does a lot of work around maternity outcomes and air pollution. It's about the houses in which we live. It's about our work and the gender pay gap. And so if we want to improve women's health, we have to look at it as a whole, this particular term, holistic approach. We must not forget some of the conditions that are invisible, and I'm talking about heavy menstrual bleeding and fibroids. There's been lots of talk about endometriosis and menopause, and this is needed. And I think it's important that it's not about pairing off one condition to another, but it's about understanding that there are so many other conditions that really haven't got the look in. So, overall, it is to say that there are such amazing people here. We all have a voice and we all have expertise. So my challenge for you all is to connect with each other and to get 1 or 2 or 3 numbers, okay, where we can then make this work. Because it's not just about representation, it's also about meaningful action and change. I leave you with that.